Okay, all right. Was the meeting properly noticed?
Yes, it was.
Roll call.
Forty's online.
Yes. Thank you.
Absent is Deborah Shu and Becky Pease.
Okay. And I have a motion to approve the agenda, please. Motion made by Grabarski, second by Pease. Any discussion? All in favor signify by saying aye.
Aye.
Opposed?
Aye.
Agenda approved. Approval of the public hearing and regular minutes from the October 15th meetings. Motion by P, second by Grabarski. Any discussion? Those who approve, say aye.
Aye.
Nays? Minutes are approved. Is there any public participation? No one is signed up. Correspondence? None. New business items for discussion and or action, report of the Department, Veteran Service.
Hi, Marge.
What?
I'm on, Marge. How you doing?
Fine, thanks. Go ahead.
All right, so start out with November. We met with 51 clients, 257 phone calls, 301 electronic transactions. We did 4 outreach welfare checks. October 9th, we completed the accreditation training in Kenosha. Scott did attend the Adams County Transportation Planning meeting on that day, and then on the 19th, we did some monthly virtual training with WDVA. Then you want me to come back on the Adams County Commission Board, or do you want me to just go over that right now?
Why don't we see if we have any questions on what you've already presented? Does anyone have any questions? Supervisor Padzowski?
Was that on item 8? We're going 1A to C. I have some things,
A to B right now.
A to B.
Yeah.
Okay. I guess this would be 1A. Can you please, question here for Rick.
Yep.
Please give us an idea of Scott Laurie's duties, pay, length of time in that position, and if the position was full-time.
Yeah, it was full time. He just resigned on the 17th of November. I gotta get into that November's.
Okay.
Right now, I don't have it handy in front of me when he started. I just gave that to somebody else, Scott Coburn.
Okay. Was that position then refilled?
No, it's in the advertisement stage right now. I'm
Okay.
going through all the applications, and I gotta get them to HR to put out for the interviews.
Okay.
That's where it is right now.
All right. I thank you for that, Rick. And then I also had just some things here on well, I'll hold off until we move to C here. So
Okay. All right. All right. Any
Okay.
questions? More
Yeah, go
questions?
ahead with C then.
All right, and then the Adams County Veterans Commission Board, they met, they went over some old business, some veterans up at King, they're in contact with. with the families, because there really is no visitation up there outside of the families. See, they went over snow bid contracts. And then they went over Veterans Fair in May County Center. They just went over the community center and what we did in May for the veteran service. A lot of it you can just read what they new business. Going over some stuff, Thanksgiving Day meal, then Christmas light parade. Then they're trying to get a theater matinee for movies on kids for December 17th. I'm not sure where that's sitting. And then they go on Ryan Larson's post what they did since the last commission meeting, and post 250 their actions and what they did. American Legion post 273. And then the VFW post 6279, what they did since the last meeting. Then the Veterans Tribute Foundation places Wings Place on the County Veterans Group. Okay, so the cap on the Veterans Tribute has been done, so the commission and whoever's in charge of that tribute, they're going to start working on the other items. I know they're making of the granite marble is taking a little longer than they thought, but everything's in process on that. And then next meeting, we're trying to get January 2nd at 9:30 at the VFW. And that's just items for the next meeting agenda. Any questions that I may be able to answer on that?
Go ahead, Supervisor Pazdowski.
Thank you, Madam Chair. I noticed that Scott Colburn was recommending flags be purchased for the disabled veterans. So I'd like to make a motion that replacement flags be purchased through Disabled Veterans Enterprise.
Yeah, that's where
recommended by Scott Colburn.
Yeah, that's where I buy them through there anyway. We already get the flags through them. And then what happens is the other posts, if they're short flags or whatever, they'll come in to me and purchase them from me at the same price that I bought them from.
Okay, so that has been initiated. I just
Yes,
seen at the
that's-
end of this presentation that it was recommended by
Yeah,
Scott
so-
Colburn for those. So
yeah,
that has,
for-
okay.
Yeah, for the other post, the order through them, but I told them, I said, if it's easier just for me to order them and then they reimburse me the price of them, I'm gonna do that, because we separated all the cemeteries out into the different posts to take care of them with putting the flags on there.
I see. Okay.
Okay,
Well, thank you for that, Rick. And I
welcome.
have one more thing I'd like to make a comment on. I was looking at it's Veteran Services, and I was looking at Mr. C, who suffers from Alzheimer's in the unit King.
Uh-huh.
Can you please give us an idea of the care that this individual is being given? Is there anything we can do to make the circumstances the best they can possibly be for this individual, as well as the friends and family?
Supervisor Pazdowski, no, that's not a reasonable question.
Okay.
Yeah,
I
that's
see
HIPAA.
that they are struggling here. We have two of these patients. And I see that there's one that is able to still go out and visit his friends and family.
Yep.
So but being the holiday season as it is right now, just thinking about, what might make it easy for these individuals to see their friends and family for the holidays. I was going to make a motion that we grant both of these individuals, Mr. C, and it's also a WB that I see.
Yeah.
That I'd like to motion a $50 gas card for each of these individuals for either them or their friends and family for the
That's-
holidays.
It's not appropriate for this committee.
Okay, Madam Chair, I just thought I'd bring everybody in the holiday season here.
Yep.
My way of showing appreciation for these veterans that struggle Alzheimer's, and if there's any way we can uplift them, this was.
Yeah,
what-
I'll try to do what I can do there. All right.
Okay,
I'll talk to
appreciate
Scott
that, Rick.
Colburn,
So,
and then we'll go there. All right.
okay, well, thank you and Merry Christmas to you,
You too. Thank you.
everybody there.
All right.
Thank you for your services and support there. So,
Yep, thank you.
Are there
Yep,
any
for
further
the,
questions for Rick? You have one more?
One more? You
Uh,
want to go?
so I was just seeing that there weren't members. There was two of them that didn't attend the Veteran Services meeting. It was in October.
Mhm.
I just was looking to see if there's any changes that can be made. Are the members all been present and attending the
Yes.
meetings? Is there any changes or anything that?
Yep, just like your meeting, we have to have a,
Five?
yeah, so as long as we have three members there to vote, we're good to go on that. I'm not a voting member. I'm just the secretary of the meeting because Scott
Right.
Colburn runs it.
Mhm.
And then they're there to help me oversee any money that I can issue. Anything over $500, they have to approve.
Mhm.
Unless it's an emergency and I can approve it up to 1,000, but.
Yeah, I
at
guess I just,
500, yeah,
I'm just looking to
Yep.
make sure that we have sufficient members that are all been in attendance and see if there's any more.
Yep, everybody's there that needs to be there, and if we have to, then we can go invite them to Zoom if they can't make it. But right now, everybody's able to attend in person.
Okay.
All right.
Good to hear. Thanks again,
All
Rick.
right. You're welcome.
Good afternoon.
Yep, you too.
Okay, thank you, Rick. Merry
Mhm.
Christmas.
Am I done, or you want me to go
Yes,
through?
you are, you are
November?
done.
Well, we gotta go through November yet. We got one more November, unless you want me to skate through this.
Oh, I think we've all read them already.
Okay.
So,
All right.
Okay,
Thanks,
Thank you,
Marge. Merry
sir.
Christmas to you guys. Happy New Year if I don't see or talk to you guys before then.
okay.
All right.
Okay, we'll go
Bye-bye.
on to the report of the department. Review September and October Health and Human Services Department Financial Report. Who's doing that one?
Wendy, is there anything you want to add to the report?
Wendy, use your microphone, please.
Thing I really need to add to the report, we're still in pretty good shape for this time of year, unless there are some questions.
Any questions, Supervisor Pease?
I know a couple months ago, we talked about the inpatient. How we doing? Are we running still within budget and how we're doing so far?
We actually discussed this today. It looks like some of the bills are running behind from the facilities, which is common. It can run several months behind. Otherwise, right now, we're still on budget.
I just think we should be kept abreast just in case. So thank you for the update.
Any other questions on the financial reports? Directors and managers, narratives? Supervisor Kozlowski.
Yeah, thank you, Madam Chair. Question is for Kelly. I do, Kelly. We have a dementia care specialist currently being advertised. Is this a full-time position and what is the pay?
I'd have to look up the pay. The dementia care specialist position is part-time.
Okay,
We believe that is one of the challenges to filling that role.
okay. And now we also have an elderly benefit specialist. Now, is this also a part-time or is that full-time?
Our elderly benefits specialist is a full-time position.
Okay,
We are required by statute to have a part-time dementia care specialist position.
okay. What would be the pay for that position then?
I'll have to look that up.
Okay. Can you tell me how many patients are currently being assisted by these two positions combined, or, I mean, or both of these positions, I should say.
Well, first thing, the dementia care specialist position is vacant. Because we are in a 3-county ADRC consortium, we're able to get assistance from Green Lake and Washera counties. As for the elderly benefits specialist, I'm going to defer to Donna, but I should note that it is open enrollment right now. So they're seeing an excessive caseload right now.
Do you have any idea? I mean,
I just talked to her about her numbers today, and she's probably seen about 300 clients in the last 3 months or so, just directly related to open enrollment. And then that doesn't include other people coming in for the routine discussions about turning 65, different kinds of benefits and so forth.
okay. And thank you for that. So I'm not gonna make a statement. So it seems reasonable and more efficient to combine the dementia care specialist and the elderly benefit specialist into one position, as the patients are in need of the same care, also putting less confusion and stress on the patients. So therefore, I'm going to motion to combine these two said positions into one position and it properly be reflected into the budget. I make that motion now.
First of all, the dementia care specialist is one that covers the 3-county consortium. And the elder benefits specialist does not.
So we could,
You have a motion on the floor. We'll see if we get a second. Excuse me, court counsel has to.
so we could combine these two into one position. I mean, it's the same type patients.
No, they're required by statute to have the two positions, and I think you indicated one is fully funded.
Both of them are funded positions. So the elder benefits position is fully funded
Mhm.
and it comes through the funding comes through our 3-county consortium. And then the 0.5 dementia care specialist position is also fully funded.
How long have we been without the dementia care specialist, Kelly?
We had a offer that we made and the individual was, for personal reasons, family reasons, was not able to take the position. So we've been working on still advertising since August.
Okay. When was that position vacated? I mean, was that,
The end of 2022. And right now we are in conversations with our consortia about how to best fill that position because hiring a part-time position is very difficult
okay,
when you're asking for someone with that level of experience.
okay.
It's important to recognize that that is not a vacant or wasn't vacated. It was a new position created by the ADRC, the part-time, so it's not brand new. Somebody didn't leave that position.
Somebody did leave that position,
Okay,
the 0.5.
all right. So then I also had a question about the coordinated services facilitator position that is currently being advertised. Now, is this also a full-time position and what are their duties and pay of that position? If you could kind of enlighten us a little bit.
The coordinated services facilitator position is responsible for coordinated CCS, our Coordinated Comprehensive Services Program, our CST program, Children's Long-Term Support. They might be responsible for our community support program. They take a variety of clients or consumers between youth and adults who have serious mental illness or substance use issue.
Okay, now
And
is
they
this,
provide wraparound programming.
is this full-time?
This is a full-time position. It is a Medicaid billable program and it covers the cost of the position in addition to administrative costs.
No. What is the pay for this position? Okay. Now, we have coordinated services committee, and as the chair, I am the facilitator of that committee. So I'm just confused on why we have a facilitator, because I'm the facilitator of that committee when we have those committees, so. Is this, it just seems like a redundancy here.
You're the chairman of that committee.
Yeah, so,
Our facilitators are required to have a bachelor's degree in human services and are required to carry a caseload
mhm.
and have a substantial amount of training to be able to perform the work.
But wouldn't it also be considered that I act as the facilitator of coordinated services as the chair? Why?
I believe county
That's
board,
just a confusing kind of a title. I mean,
I believe county board rules don't allow for county supervisors to be doing active employment.
It
For
just
the
seems,
county.
it's kind of a misleading title though. Is there a way we could
You are not the facilitator, you are the committee chair.
But in the rules, we facilitate the meeting as the chair, right?
Perhaps we can explore the job title through the upcoming wage study.
Okay. Yeah, we might just have to just kind of change that a little bit. I had some more questions. We can,
Does anyone else have any questions? Then we will move on to the project status report.
I have one more in that. I didn't. I would also like to. I'm looking at the acronyms and it seems that when we're not spelling out these full terms in the agenda, it's somewhat confusing and it's counterproductive to have to go back and forth to the key. I really don't see a reason why we can't just type in these acronyms or these words into the agenda. So I'm gonna motion at this time to terminate the use of acronyms and completely spell out the full terminology as to gain clarification and understanding and often what the topic is within HHS agendas, which would also facilitate the review and meeting process time.
Is there a specific example you have of this?
When we go to the director's report, at the end of the report, we have the
You're talking
acronym.
the report, you said the agenda. You were addressing the agenda.
Yeah, it's in the
agenda.
director's report.
That's a
now-
report.
There's been some use, but I see no reason in any upcoming agendas to use these acronyms. It just causes more confusion. It makes it harder to decipher these agendas for us and the meetings, causes more questions. So when we get to this here, can you scroll to that, please, Lana? The acronym list here at the director's report, it's at the end.
Madam Chair, could I make a point of order?
Please do.
There's a motion on the floor that has not been dismissed, the one that did not gain a second. So
Yes.
if you could get rid of that one before he could make another motion.
Thank you.
Thank you. Okay.
So now I'll repeat that motion. So I motion to terminate the use of the acronyms.
No, not that motion. Are you talking about the motion about combining the positions?
Yeah, that we didn't get a
Supervisor
second on.
Gabarsky?
So you got to vacate that.
The one to combine the positions. Okay, there's being no second, that motion is dismissed.
Right. So now it's clear, so now I can make another. So this one was motion to terminate the use of acronyms and completely spell out the full terminology as to gain clarification and understanding on what is often the topic within HHS agendas. This would facilitate the review and meeting time processes.
Do we have a second on that motion?
1 second.
Being none? That motion is also dismissed.
Okay,
I don't have that much paper, Josh.
And, all right. Let's see. And then, I have a question here. This is for Kelly, please. I look on here and we have, pending position cuts for the billing specialist and social workers. Now were these full-time positions, and can you please tell us what the
What
pay?
page are you talking?
This is in the director's report. It's at the beginning.
May I?
Go ahead, Kelly.
The billing specialist position was eliminated in the 2024 budget. The social work position was cut for the 2024 year, so they were pending throughout the year. They've been on hold for the reason it says that is they are on hold. They are gonna pen through the rest of the year. We are not filling them because they have been eliminated for 2024.
Why have they been eliminated, Kelly? Can you tell us?
You may recall from some of our other narratives and conversations that we have built some efficiencies in the financial department. And we have been able to absorb the billing responsibilities of that billing specialist. So we did not fill it. We hadn't filled it for several months to see about our ability to absorb those responsibilities. As for the social work position, our caseloads have decreased some in children and families. A lot of that is kind of following the trend related to the pandemic. And because the loads are down right now, it was a fiscal decision to remove that position. And if we get in a situation where we need to add a position, we'll come back to the board and ask for that position.
No, has that been reflected in the budget?
It
How
would be
was
reflected in the
that?
2024 budget, yes.
That has not been in this last cycle reflected?
Those positions were budgeted for all of 2023.
Okay. And what was the pay on those? Do you have?
The social work position depends on whether or not the individual is certified. The beginning pay for that position is $24.93 if they are certified, or $23.18 if they are not certified.
That's hourly. Do you have any salary or any annual? Okay. Let's see.
Gosh, those are listed on the website. Description of jobs and then the
Yeah.
category they're in. So you could find it there.
Okay, I mean, some of this just isn't very clear sometimes. Kelly. Thank you, Bob.
We will now move on to the project status report. Are there any questions about that? Supervisor Kozlowski, did you have a question on the project report?
No.
It was dismissed for lack of a second. We're sticking to the agenda. And there is nothing else.
Okay, so I would also. I'd like to motion to add and identify upcoming agenda items to the agenda. I'd like to make that motion now.
You're asking something to be added to the next agenda?
Yeah, I'd like to add agenda item as an agenda item, you know, as most other committees have
Madam Chair,
that in the agenda.
I
Supervisor
would think
Pease?
that what he's asking should have been done under number 4. When it said to approve the agenda, you should have, at that time, should have said, I would like to add this as number 12 or 13 as, but I think we could take it under advisement that it should maybe go into the next agenda.
Good
Okay.
suggestion.
That's suitable, Rick. Thank you. Yes, I'd like to add that. I'd like to motion that. Get a second?
It's not necessary.
Okay, so we'll add that in. Okay, that sounds great. I really appreciate that. And then I'd also. So we got to clear that motion, Madam Chair, that I just made.
No, it's not. a
Not seconded.
motion.
Okay. All right, so I have another motion. And that would be to look at this committee's committee rules as an upcoming on the next agenda. To see if there's any changes that we could make on our committee rules here. So I'd like to put that on the agenda and motion for that at this time.
Okay, go ahead.
There is a committee on the county board rules that will be meeting for this.
Wednesday.
Yeah, and because that committee's meeting before your next hearing, it wouldn't make sense to put it on the next agenda. However, I suggest that you go to that committee if you have suggestions to make.
I'd like to just put it on this for the next agendas for discussion. So we have it on there. So after this meeting, we can discuss what needs to be changed. So I'd like that added, please.
He can make that motion.
Okay,
I'd like to make that motion to add that.
there's a second on,
Changing the,
there's a second on that motion.
I'd like to review, I'd like the motion to review and possibly discuss and change the committee rules of the HHS committee. And I make that motion now.
Is there a second to that motion? Seeing none, it's also dismissed. Supervisor Grabarski.
I just want to clarify, to review the board rules, it takes some time. A lot of times we meet several times in order to go through them all. So my guess, Josh, would be that it would be premature to try and get it in January already. And quite honestly, the new board is the one that approves them. So sometime between January and April, there's a 3-month period. We review the board rules, go through them all, and add and subtract whatever it applies. And it's just, it would be premature to do it ahead of time, I'm afraid. So that would be my stance.
All right. No, thank you for that, Bob. Thank you.
Supervisor Pease, did you have something to add?
Or in this committee, that's what the board rules committee is for, is to take everybody's ideas and then bring it forth to the board. So that's the time to change any type of rule.
Correct.
Okay. And then we have, are we nearing the end of this?
We have a report yet on committee members.
We'll go through with that before I make my next motion, please. Thank you.
Are there any report of the committee members on the Aging Advisory Committee?
Yes, we met on November 2nd, the Aging Advisory Committee, and we discussed we informed the committee of the request for proposal for nutrition program. We talked about the transportation projects, the upcoming application and the public hearing that was to be held on November 21st. We also talked about advocacy, specifically around volunteer recruitment for drivers. We also discussed our financial and that the November was National Family Caregiver Month, and Social Isolation and Loneliness Week was also discussed with the committee members. Our next meeting will be January 16th, 2024. Then I'm going to report on the governing board for the ADRC, Aging and Disability Resource Center. They met on November 9th. Jennifer Dilly led the meeting. And they talked about the Aging and Disability Resource Center local activity, including the Independent Living Support Pilot Program, management team meeting updates, and the change projects. They had a presentation from a resource specialist, Vanessa, who talked about functional screens and how that works. Jennifer also discussed briefly the ADRC directors meeting updates, including some of the funding that they're looking at. And then they discussed the governing board rules and responsibilities and the importance of recruitment for their governing board. They also updated and approved their governing bylaws, and their next meeting will be determined at future date and location. Any questions?
Are there any questions for Donna on either of these committees? Seeing none. Our next meeting date is January 8th. Supervisor Podzowski, yes, go ahead.
For adjourn. As I would like to make another motion, as HHS did not have a meeting prior to the county board meeting on the budget last month, I motion that the HHS budget is resubmitted to the county board for review and approval. I make that motion now.
I believe once the board, county full board has accepted and passed their budget, it's not subject to further submission by a committee.
And that is correct. It's already been approved. The only way to amend the budget is to bring in some motion there, and then you need 2/3 vote. So right now, it's already been approved.
Is there a second to this motion? Seeing none, this motion is dismissed. Supervisor Podzowski.
Yes, Madam Chair. So we have some material here I'm looking at that I would like to separate out of the closed session portion here, and that would be the Adams County Nutritional Program. As this is a public service, the public should be discussed. It should not be discussed behind closed doors, as the taxpayers deserve to know how tax dollars are being appropriated in their best interest or not. So at this time, I'd like to motion to separate this topic and bring it into this regular meeting minutes and take it out of the closed session minutes.
Josh, I can tell you that I looked over this. It does fit the closed session requirement. If there are actions on that come out of the closed session that require open meeting, that would be done at that time. But right now, what's going to be discussed in closed session is appropriate.
Now, I was reviewing this last week and it wasn't highlighted. This was amended to go into closed session. It was not originally presented in a closed session format. So I'm wondering why the change was made to suddenly put this from regular meeting time to closed session. I believe it was Friday.
It It was done at the advice of Corporation Counsel that it needed to be done at closed session.
And when was that discussed or when was that done?
This particular item was put on afterwards, what was amended because the information that you need to discuss in closed session wasn't available at the time that the original agenda was made. So then it came in and that's why it's an amended agenda now. So you can discuss it.
What was the information that wasn't available?
That will be discussed at closed session.
If you want me to clarify, the request for proposals were due on December 1st at 4 o'clock. Our agenda goes out on December 1st.
Right,
And it generally, we have it finalized and approved Friday morning. So we didn't know if we had any approval, any bids or not.
okay,
That's why it went out generic.
okay, all right. I appreciate that clarification. Thank you, Kelly. Thank you, everyone.
The Health and Human Services Board will convene in closed session per Wisconsin per Wisconsin statute, section 19.85 sub 1 sub E, for the purpose of deliberating or negotiating the purchasing of public properties, the investing of public funds, or conducting other specified public business whenever competitive or bargaining reasons require a closed session to discuss and or act on the Adams County Nutrition Program and the possibility of the need to contract for services for this program. Excuse me. Yeah, motion made by Pease, second by Grabarski. All in favor?
Roll call.
Roll call, I mean, sorry.
Edwards. Gabarsky. Carlson,
Yes.
RPs. Podolsky,
No,
Shu. Beaversdorf,
Yes.
BPs. Long,
Yes.
Okay, Diana has to take care of some business here before we can start. Okay. Okay, we are back in open session now. And Supervisor Pease,
I'll make a motion that we accept a bid from the consolidated contract to include food and staff costs with the county administrator. I don't know how I said that, county administrator
to put
To-
together a severance package for one
Exactly.
employee.
for one employee.
I have a motion. Do we have a second?
Carlson second.
Any further discussion? All in favor signify by saying aye.
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 I don't, you know.
Aye.
No. Aye. Opposed?
I,
Just announce what the vote was.
Yeah.
Okay, it's 5 yes, Edwards, Gabarsky, Pease, Carlson, Beaversdorf, 1 no, Podolsky.
Okay, there being nothing further to come before this committee, we are now adjourned. Thank you all.
There we go.
It's the first time I've ever conducted.